significant proportion of Nigerians are unaware of their genotype prior to marriage, and this has led to unending suffering for children who suffer sickle cell disorder as a result of their parents' genotype incompatibility. The importance of undergoing marriage counseling as these health issues, and also different ways to navigate the problem of sickle cell disorder, is what we are discussing today on this episode of Deep Dive. My name is Tracy Dominic, and on today's episode of Deep Dive, I'm here to have a one-on-one talk with a medical practitioner, Dr. Chima Chidubim. Thank you so much for giving us this time.
Thank you very much, Tracy. So it's a pleasure.
Yes, of course. So talking about this issue of genotype incompatibility and sickle cell disorder among children who suffer these health issues, there have been so many cases in today's society. How would you describe one's genotype and the possibility of birthing a child with a sickle cell disorder?
Okay, thank you very much for that question. The sickle cell disorder in particular, okay, it's been one that has been of concern for years, okay, has wreaked lots of havoc presently. So now, talking about the genotype, we would like to bring it down to what everybody could go tally with. This is a system, okay, that has been designed in order for us to have a peek on the various traits that one could portray as they grow up, phenotype-wise, that's physically, and then the genetic makeup, down to the elemental levels, the cellular, molecular forms. And now putting it into consideration, the topic, the sickle cell disorder. This is a trait found amongst the genotypes, okay? Now, this system has divided or subtyped these genotypes into AA, AS, the SS, which is the main issue we have on ground. And then we've had some, the AC, the SC, and the rest of them. So be that as it may, this very disorder emanates from a mutation being an aberration, a change, okay, that happens molecular-wise. You will agree with me that when you talk about structures, you start from foundations. So this is the foundation of living, cellular form, okay, down to the genetic level. When there is an exchange, rather, of a particular element, okay, now the valine, the glutamic acid, by the valine, okay, element. Okay. So this is what causes this. It's the bane of what we are talking about, actually. So it translates to this very abnormality that has to do with the red blood cells in particular. So what they do is, this very mutation causes a change, a disorder in the normal shape of the red blood cell. We've all heard of red blood cells. They are primary part of living for every single person. So now, when you have this change, like the name goes, sickle cell, the red blood cell assumes a new shape. Now, note, everything in nature is designed for a particular purpose, down to the details. Now, once a detail is distorted, you will agree with me that its purpose will be distorted too. Okay? Now, this distortion leads to the inability of the oxygen molecules to bind to the red blood cells. Because obviously what the red blood cells do is to take up the oxygen molecules. You breathe in and out, they are molecules. They bind on these red blood cells. Now, the biconcave shape of the red blood cell is lost, and it looks like a sickle. So now something that usually ab initio would look this way, cupping, let's put it in the understandable format now. Bind to the oxygen molecule, still bind to the oxygen molecule, is now sickle in shape. You know what that entails. Its ability to bind to these oxygen molecules is decreased. And when your body becomes deficit in oxygenation level, hypoxia sets in. Hypooxygenation, that is low blood levels of oxygen. Tissues in the body begin to die. So that's just the primary definition or explanation to this.
Okay, so coming down to my second question, how does it, what's the possibility of someone with a sickle cell trait birthing a child with the disorder?
Oh, in the society these days, especially before you get married, we say, check your genotype. Okay? Now, an illustration is in the cross typing of these genotypes. Okay? I mentioned the AA, the AS, and obviously the SS genotype. The AA means that this particular genotype does not have the sickling traits. We are not talking about the red cells now. We're just talking about that property that confers the trait. It directs you, hey, form the shape sickle. So that AA genotype, it doesn't have that trait. So those individuals in no way will have their red blood cells trying to assume these abnormalities. Now, stepping it down further, you have the traits, the genotype of the AS. Now there is an S, noting that there is the sickle traits right there. So this is a mixed breed, put it rather. We call it heterozygous. Okay? So this mixed breed in the interim or in place now instructs the red blood cells to form abnormal shapes. But like I said, it's heterozygous, it's mixed. So we are going to be having the normal and the abnormal coexisting together. Then we move on to the sickle trait proper, the SS. What does that mean? We are over the top sickle. So that is it. Now, when there is a union between someone that is an AS and another that is an AS, now we have two individuals whom have a combination of these traits and a combination of these traits. So elementarily, when these things mix up, it's like cooking. They become one entity. And then the father offers his S trait, the mother equally offers her own S trait, and we land ourselves in this very disorder.
Okay. You know, there are so many misconceptions in the society about the sickle cell disorder.
Sure.
So, what do you think are the myths surrounding people with sickle cell disease?
Oh, okay. Let me start with the one I just had in mind right now. There is this misconception, you know, they say love is blind. Yeah, but is it actually blind? There are consequences. Now, when there is this case of the love is blind, and then there's this union between the heterozygous traits, the AS and the AS. Now, people tell you that out of every 4 children they have, just one is going to be the sickle. And then they could say, okay, we love each other so much, we could manage it. That's not true. What it means is that in every single pregnancy, each conception the woman has, there is a 25% chance of having a child who is a sickler. Every pregnancy, not the entire children the woman has. So what it means is you could have a child who is a sickler.
You mean whether the woman has a sickle cell trait or not?
No, she will have the trait.
Okay, she have to have the trait before she births.
At least an S.
At least an S.
Exactly.
Okay.
Now, when this happens, each pregnancy, and peradventure she has a partner who is an AS, each single pregnancy, there is a 1 in 4 chances of having a sickler. Now, what if it's just like going into the market and I'd say, oh, throwing a dice, you just don't know, you wouldn't know where it falls. What if each time you throw the dice, it falls into a sickler? That means you could have the entire children of the family being sicklers. You don't choose it, okay?
Okay, so what are these some of these genetic traits? What are some of these health problems sickle cell children
You
face?
have.
Yeah.
There are lots of them. It's quite tearing. It's sad when we see them happen. Okay? Now, when you have children like this, obviously, most of the times, we frequent hospital visitor. They are obviously patients a lot of times, okay? From conditions that come up. You have the vaso-occlusive crisis, as we term it, and then you have the acute chest syndrome.
Dr. Chizzy, come in the layman terms so that our viewers would understand.
Forgive me.
Because
Forgive me.
like
Forgive
when you
me.
talk about this term you just talked about, like what are the crises about? Is it the person is weak, the person is not able to eat, or what are
Okay.
some of these things they face?
Okay, thank you very much. When you talk of the vaso-occlusive crisis, to bring it down, we have sickled red blood cells moving within the blood vessel. The vessels are like pipelines, okay? They convey these very cells. Now, when you have the red blood cell, which is obviously, call it somewhat circular, call it somewhat spherical by the name, it's actually spherical. It finds its way easier and much, it transports better within the blood stream. And as it rolls back, it's circular in shape. It keeps on rolling. Now we have a sickle. You will agree with me that the traffic would not be as smooth as the other. Now there are blockages within those tracts, the blood vessels. So they clog, they block up those very blood vessels, and then the tissue to which they are meant to deliver oxygen suffers. That's what we call infarction, necrosis. They begin to die because we are starving them. When I starve you, I mean, you know what starvation can cause. So that's what happens to these tissues. So now, when you starve a particular area, this necrosis, they start coming up with inflammation and so on. There is acute pain, severe pain most of the time. Okay? And it has also this trait characteristics of causing dehydration. Dehydration means that the fluid level in the body begins to deplete, which further worsens this crisis, vaso-occlusive crisis. You have severe pains, and these pains start from very significant area. You could have from the feet, you have at the hands, you call it dactylitis. At the same time, severe pains. Some at the waist, some within the vertebrae, that's the backbone. You have some at the humerus, femoral bones. Very deep-seated pains now, which are unbearable. So when you see some of them coming, they are shouting of pain. We also have some other consequences, like the acute chest syndrome. Now, when these vessels become clogged or blocked, okay, they don't deliver the required nutrients and oxygen to that very tissue. Now, in particular, the lungs. We all know how important the lungs itself is. Okay? Now, when the lungs is starved, it's an air machinery. It begins to cry out. Tissues begin to die. What happens? You will suffer it out.
So with all this biological suffering these individuals face, in your opinion, do you think there's enough medical care and policies in the society for people who suffer sickle cell disorder?
Okay, I'll answer you like this. We could do better. We could do way, way, way better. Our health insurance systems, we could make them work better. They work way below their expected standards. When these parents come in, because of frequent hospital visitations, they're out of money, economically down. Now, to sustain this child's health intervention, you would agree with me that we need some level of health insurance to play a key role to help this child survive. What of trust funds? How many have we set up and devoted it to sicklers? Because we have children dying steady. A child has stroke because of sickle cell anemia. A little child. A little child can just go blind because of sickle cell anemia. What of the segregation from the public? The neighbors, even family members, sometimes the parents. No, I don't want to have anything to do with you, and if you're the source of my problem, I mean, come on. Psychologically, the child is battered. We could go on and on and on. So we could actually do better in trying to save these children.
Absolutely. Doing better will be one of the best options we'll have. So studies have shown that bone marrow transplants could be the cure for sickle cell disorder. Is that the best cure, or is that the only cure? Because studies have also shown that that is quite expensive. So aside that, what other thing can the layman do to cure sickle cell disorder?
Thank you for that very, very important question. You would appreciate why I was smiling or laughing. Should I tell you how much a bone marrow transplant costs? Let's say locally, you can get that treatment anywhere below 11.5 million. Naira, 12 million. Now, if you want to go overseas, we're talking of 25 million and above. Put into consideration the present economic situation. Who has that kind of money? You can source out very little persons who can afford or have this level of economic buoyancy. Okay? Now, the bone marrow transplant, that is the hematopoietic stem cell transplantation, because that is exactly what is done there. It's magical. Okay? It's simply phenomenal. You could get a child who is a sickler, the SS trait, and I didn't mention the AS is also called a carrier. Okay? They are just packaging it to give to you. And just with so much stress, they could come down with those crises too. Okay, but it's quite rare. So the bone marrow transplant itself now goes deep down to the stem cells in the bone marrow and reverses this abnormality. Okay, by still exchanging those codons. Okay, this very aberration happens in that is the beta chain codon. Okay, they go down to the molecular level, and then you have this child now continuously exuding the genotype AA, because that is what you're going to go for.
So is that the only way for a sickler to change his or her genotype?
Yes, for cure.
Through the bone marrow transplant.
Any other thing we do for these children is management.
Okay.
We manage. Okay, in medicine, when you talk about manage, you talk about the treatment of the child. Okay, we have different ways of helping them. Take, for instance, this very program, the awareness. And we need to educate them on how to take better care of themselves. That's where the love and support comes in. And then we begin to tell them, don't get yourself overworked. Take your medications from time to time, because they do need blood transfusion from time to time, although they have this very wonderful characteristic of being able to handle anemia, that is the low blood level, better than those who are acclaimed to be AA. Okay? So there's this drug, actually, the hydroxyurea. Okay? The hydroxycarbamazine. Very wonderful. It tries to take the adult or the very patient back to the earlier days. Because when you give birth to a child, you would, except for the typing, genotyping and all that, you wouldn't know if the child is a sickler and all that. Till the child starts growing, starts having the short stature and so on, you could confirm. But then, this fetal hemoglobin, the very element that holds the oxygen molecules at that very point helps the child go through the stress of sickled cells. Okay? So because it can harbor this oxygen well, it's much preferred. Now this hydroxyurea helps us to make the bone marrows push out or form more of the fetal hemoglobin. Okay? Then we could have this child survive in this very part. Apart from that, we could help them stay away from infections because they are stressors that bring up this crisis. Infections
Okay.
there is one of them. Okay? And then you could help them stay away from things like, just like you said, infections, malaria, and the rest of them, which could also pose issues. It would be important to mention, okay, what we call the heterozygous advantage, okay? When we talk about the carrier, the AS, there's this advantage they have when it comes to the Plasmodium falciparum, which is one of the species that carry the malaria parasite, okay? Now, they survive malaria better. They handle it better.
Okay.
Though. But the sickler already has a crisis. So he's in dire need. He's in trouble already. So when they come down with this, it's trouble. Now, could you imagine as well, some of these children have what we call priapism, erection. You see a child, the genitals become erect. I'm talking of the male. There's nothing he can do about it, and it's very painful. Imagine the embarrassment.
That's one of the symptoms.
One of the
sickle cell disorder.
Exactly, complications that come through with it. So what do? There are drugs to help these people. The tamsulosin, they call them the beta adrenergic blockers. Okay, what they do is they bring down this very what do you call it? The blood flow and so on. So it comes down, and then we continue to give them emotional support to go through this very condition, because it's not a death sentence. Several live past and meet very big expectations.
Okay, aside all the health-related issues associated with sickle cell disorder, and of course, not to mention the stigmatization and all, some persons still want to test the strength of their love and, go ahead to marry despite knowing that their genotype is incompatible. So what would be your advice to such people?
It's very simple. No, don't do it. It's absolutely not worth it at all. If you see these kids in the wards, in the hospitals, and you see what they go through, it's agonizing. The parents, you can't handle it, I bet you. They go through so much, body-wise. Some go as far as asking, why me? Some even get to hate the parents. Yes. So it's not worth it in any form. I know it may be difficult to let go of your love, let's put it. But then, save that child years or a lifetime of tears and wishes of I'll meet it.
All right, doctor. Thank you so much for sharing these important health tips. Thank you so much.
Thank you.
Okay, we've heard all those important health tips. Well, if you still want to go ahead to marry your one love despite the genotype incompatibility, then you'll be doing that out of choice rather than ignorance, because we've shared so much on this episode of Deep Dive. Thank you so much, viewers, for sticking with us. Please, if you haven't already, do follow us on all our social media at First News Nation to get important notifications like this, and also put your comments in the comment section below. I would love to hear what you think about this topic. You can also follow me as well on my social media handle at Tracy Dominic. Thank you and goodbye.